There had been many illnesses that plagued the earth, and claimed the life of thousands if not even millions. These viruses caused horrors to those who have been affected, and to those who lost their loved ones due to these diseases. But history still has its most terrifying disease amongst all: the Black Death. This plague is caused by a bacterium called Yersinia pestis. If infected, it will cause serious swelling as big as an apple in some parts of the body, with the blood oozing from it. Dying flesh turning black followed by fever, chills, vomiting, diarrhea, severe aches and pain. And in short order, death. The plague claimed millions of lives in Europe during the Middle Ages. It was called Black Death due to the dying flesh turning into black, and to the horrors it brings to its victim. It is said to be originated in Central Asia in the early 1340s, where it's already claiming lives of its victims, such as in China, India, Persia and Egypt, carving its deadly path through the trade route, such as the Silk Road. Kaffa, a small and fortified city along the Black Sea, were on the attack of the Italian merchants, but locals from the city seek help from the Mongol army. Unknowingly, the army is already infected by the plague, and so many soldiers died that they were forced to call off its one-year-old siege in Kaffa. But before leaving the city, Mongol prince ordered to put the plague-infected body into catapults and hurled them inside the wall of Kaffa, where the Italian merchant celebrates their victory against them. Few days after, water supply had been infected and people begun to die. Italian merchants tried to escape back to Italy with their trade ships. Unknown to them, rats being infected by the bacteria was able to climb into their ships. They sailed through the Mediterranean trying to dock into different ports, but being rejected as port masters noticed the sailors begun to die. And in 1347 their trade ships anchored in port of Messina in Sicily. Port masters tried to isolate the ships, but it was too late. Horrified by the scene in the ships, masters immediately asked the ships to leave the port due to the death of its crew, but the short encounter was enough for the plague to crawl back into the land and begin its deadly outbreak. In Europe, every day, 700 to 800 people are being killed, cutting a third of Europe's population through its 5-year course. Doctors during the Black Death were totally unequipped with the medical knowledge on how to cure the plague. Most of them treat patients in an unthinkable way of treating an illness, such as drinking the patient's own urine, eating chopped snakes, boil lancing. Until then, no doctor was able to find a cure, and most of them decided to refuse meeting with any patients. Priests also refused to do a last rite for the victims. Most of the healthy people during the plague do their best to escape. Inhabiting countrysides, little do they know that animals with them were also infected. People were totally overwhelmed, and were not able to comprehend the reality of the Black Death to such extent they treat it as God's punishment to their sins, thus leading to the murder of troublemakers and sinners. Thousands of Jews were also murdered from 1348 to 1349 to win God's forgiveness. Some of the upper-class members joined a public display of penance and punishment for 33½ days, beating themselves 3 times a day. After its 5 years deadly course in Europe, Black Death occasionally appears centuries after, still claiming lives. By the 17th century, doctors who tried to cure the plague wore the plague mask, a beak mask full of herbs on its long and pointed nose, together with a coat, gloves and a stick pointer to examine the body without the doctor touching it, a safety suit for them to avoid being infected. The plague had said to reduce the Earth's population from 450 million down to 370 million at that time. And it takes 150 years for the population to get back to its previous numbers. Lack of medical knowledge during this time kills most of the people during the outbreak, but medical experts and researchers still on a debate about the extent and degree of its damage in human life, the numbers and the environment as a whole.